out, damn spot, said Lady Macbeth as she tried to get rid of the germs of crime. It seems that in the real world, more and more people are just as obsessed with washing away the germs. Ansuya Naidu from Durban North cannot stand dirty hands.
An estimate of how many times I wash my hands a day would be at least 20 to 30 times. And that's the least number of times, apart from washing my hands before and after eating, before and after going to the bathroom or to the loo, or even before and after touching any equipment or any documentation.
She says she has to keep her hands clean because there are germs everywhere, from doorknobs to desktops. And the scary thing is, you can't see it with your naked eye. Ansuya's obsession with clean hands intensified after she became a mother. So understandably so, it's the squeaky clean habit that she plans on sharing with her daughter.
Sometimes I may be in my own house, and if I've been playing with the toys or picking up the toys after my child, there's a good chance that 99% of the time I'm washing my hands even after I pick up all the toys from the lounge. And I don't just wash my hands with soap. I try to use dispensers where you don't touch, or dispensers that are easy to use.
Well, why go so far? Lotus FM's very own Fahim Jamadar is a compulsive hand washer. Fahim washes his hands up to 50 times a day.
When I touch something, it feels dirty. That's why I wash my hands. And if I don't wash my hands, then my hands have a funny feeling. So I have to use soap and water. That's when the feeling goes away. It is very time consuming and can be very irritating. From the time I get up to the time I leave home, I wash my hands about 15 times. You know, if I touch my shoe, I have to wash my hand. Put on my clothes, wash my hands. Touch the keys, wash my hands. You know, but if I don't do it, then I'm going to have to trace all the way back to all the things I touched and then use wet wipes to wipe all these things, which is more irritating.
So is Fahim happy about making a splash about clean hands? While he does enjoy being clean, he says this isn't normal.
I would think I need some sort of intervention because this is not normal behavior. I mean, a person washing their hands 50 times a day is not normal. I know that because I wasn't always like this. Something, I don't know what it is that happened, but something has changed it where if I touch anything, it feels dirty. So I'd rather just wash my hands and know, okay, everything is clean.
Well, there's some method to the madness. Durban medic Dr. D.K. Pillay says there's definitely some big bad germs lurking around. But alarmingly so, they originate from a place you just can't avoid.
If you look at personal hygiene, when one uses the loo especially, you can get a lot of fecal contamination onto the hands, especially E. coli. Basic washing of the hands can prevent the fecal-oral transmission, and it can prevent a lot of gastroenteritis type of infections. In terms of flu, those are more viral and airborne particles, but hand washing, I suppose, does have a role in preventing any type of infection.
Dr. D.K. Pillay says hand hygiene is essential, but you don't necessarily have to wash 50 times a day. He says there are antibacterial alternatives.
One can carry around normal hand sanitizers instead of just washing their hands. As doctors, we normally wash our hands after the contact with every patient. So in between patients, it just prevents the common spread of pathogens from one patient to the next. The basic thing would be washing with soap and water, and the normal hand sanitizers should be fine.
This is why the World Health Organization is committed to promoting the Save Lives, Clean Your Hands campaign. It proves to be a simple task that can save the lives of millions. Recently, Unilever visited Umlazi, south of Durban, on a healthy hand-washing campaign. Chairman Marin van Tigelen says WHO blames lack of hand hygiene for increased cases of chronic diarrhea.
In many countries, the number one disease causing child mortality between the age of 0 and 5 is actually chronic diarrhea. And the number one cause for chronic diarrhea is children not practicing hand washing. The president, Margaret Chan of the World Health Organization, said the number one thing to do is teach kids how to wash their hands before they go to the bathrooms, before they eat, and before they go to sleep. And that is what we're working on.
The Save Lives, Clean Your Hands campaign encourages all networks to tidy up their acts and promote hand washing as the number one way to stay healthy. Whether it's 50 times a day or a quick squeeze of hand sanitizer, a fresh pair of hands, it seems, can change the world. For Newsbreak, I'm Taresh Hariprasad in Durban.